kabarkan berita, membuka cakrawala. Semua bertaut udara di gelombang semesta. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia. Gaya budaya alam katulistiwa. Kita kabarkan berita, membuka cakrawala. Semua bertaut udara di gelombang semesta. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia, sesungguhnya langit aspirasi bangsa. Kita Indonesia, sesungguhnya kita hadir bagi dunia. Kita Indonesia, sesungguhnya.
Voice of Indonesia, the overseas service of Radio Republic Indonesia, broadcast in 9 language services: English, French, German, Dutch, Spanish, Arabic, Mandarin, Japanese, and Indonesian. Voice of Indonesia is broadcast via shortwave 3325 kHz and 4755 kHz, and via streaming on voinews.id and RRI Digital on mobile application. We present various programs for you: Diplomatic Forum, The Session, Indonesian Wonder, Miscellany, Let's Speak Bahasa Indonesia, Indonesian pop and regional songs, international musical entertainment, as well as news and information about Indonesia and abroad. Voice of Indonesia, from Indonesia to the world.
Voice of Indonesia, from Indonesia to the world. Welcome to VOA Talk from Voice of Indonesia, the overseas service of Radio Republik Indonesia, with me, Rahma. Listener, since mid-February 2025, we've seen global COVID activity, on the rise again. And test positivity rate hits even 11% levels we haven't seen since last July. And this rise is primarily observed in countries in the Eastern Mediterranean, Southeast Asia, and Western Pacific regions. So to know more about the spread of SARS-CoV-2, especially in Southeast Asia, joining us today on VOA Talk, Dr. Dicky Budiman, PhD, as the Global Health Security Expert of Griffith University and Yarsi. Good morning, Dr. Dicky. Thank you so much for joining us.
Good morning.
Good morning.
Yeah.
Good morning. Well, on today's VOA Talk, let's give us a more clear insight to make it clear about SARS-CoV-2 virus. So what exactly is this virus, Dr. Dicky?
So as we know so far, COVID-19 caused by SARS-CoV-2, which is during 2019, end of 2019 up to 2023, become the cause for the COVID-19 pandemic, the largest outbreak in human history after 100 years. So COVID-19 now, after pandemic era, become endemic. It means we will see these cases every day, everywhere. But of course, the COVID-19 disease will follow certain, I would say, we call it form. Like there is increasing case usually when the mobility of human in a peak season, like usually in January or December, and also because the main transmission of this disease through air, that's why it's easier to spread in many areas. And in the other also factors why COVID-19 now is become a serious, they become the one of the respiratory disease among notable disease in global, except for example, with the influenza. COVID-19 also can infect many people, not only adult but also children and also baby. But the most vulnerable ones is the one who has a weak immunity, for example, elderly and also children. The good things for this COVID-19, in very short time, after long term of research for vaccine, we can get this effective vaccine, which is now, that's the reason why we see even many new subvariant of this COVID-19 virus appear almost every month, not only during the pandemic, but also after the pandemic. So we see there is no rising case in terms of hospitality and also fatality. That's because the herd immunity has been achieved through vaccination program, including in Indonesia. So the good thing and the good news in this rising of the COVID-19 case, the vaccine, the immunity is still effective and still work, except for this several, a few population like elderly with the weak immunity, that one.
Okay, so besides transmission by air, despite having lockdowns and vaccines before, so how can this virus spread again now?
There is no difference transmission mode for this disease now, but the new subvariant now is more effective in make an infection to the people, and that's because they have a mutation in their spike of protein, which is make it easier to attach and I would say to do the human body cell in our respiratory tracts or canal, and the other also way for this virus to spread is also because it is not only the air, but it should be in close contact and also in the, let's say, indoor situation. And the air quality at that time, it should be also in low level. And that's why now we see the rising case of this COVID-19. This because after pandemic, now everyone going back to their habit, going anywhere, and usually they also disobey or reducing their awareness and also behavior in terms of personal hygiene. That's why we see this the case of COVID-19 rising again. And again, the recent epidemiological surveillance data from regional health authority and its international database, including the WHO, show that upward trend in COVID-19 cases across multiple countries now. In ASEAN, this includes increases in countries such as Singapore, Malaysia, and Thailand. Indonesia, even though up to now still not report the rising case, but we have to realize that our surveillance system and also the detection and also tracing is not as much as the pandemic's era. That's the reason. And of course, this resurgence is not entirely unexpected and can be attributed to several interrelated factors.
Okay, so any difference that people should know about this virus compared to the previous one?
So far, the most unique and also the update character of this new subvariant is about in the way they infected people. It means it's more effective. If we remember during the pandemic COVID-19, at that time I was in Australia. So in Sydney at that time, if I'm not wrong, it's Kappa variant. At that time, it was need like more, around 1 minute to transmit among people. But for this subvariant, it's less than that one. So it's maybe 30 seconds or something. But it's mean the most important message that we have to I would say aware that now, because the evolution character of every human, every living world living thing is in the world. So including virus, they have to, I would say, go inside the body or human body as fast as they could, because if they, I would say, they are in environment, let's say in the soil or something, so their ability to survive is decreasing significantly. So that's why the mutation, the evolution of this virus should be in the way how fast, how effective they infect the human.
And it is also determined by individuals' immunity then?
Yeah,
Oh.
including, yeah.
Like whether it's faster or not. So individual. Okay. So about the first new wave, it is known where this new wave first began?
Yeah, the epidemiological data say and also show us that there is increased test positivity rate in countries where testing remain active, or positivity rates have increased. Like you already mentioned in first of our session, and it is indicating a true rise in transmission, not just detection, and also hospital admission. Moderate increase in COVID-related hospitalization has been also reported, mostly among high-risk group, elderly, immunocompromised, and those with comorbidities. And also the epidemiological data we see and show related to this increasing COVID-19 cases is about from wastewater surveillance. So several countries have reported increase, especially it should be developed country like Singapore or Australia or many countries in Europe and also USA. They reported increased viral load in wastewater analysis, a key early warning, which is a key early warning indicator of rising community spread. And the last one, the dominant variant at the global level is PB1. PB1 now has linked with the BN1 8.1, so the new subvariant. So the all of them is still also lineage of Omicron variant, and now they are currently dominant for PB, and it seems BN also will be replace the PB to become dominant at not only at the national but also at the global. And these variants are more transmissible and have partial immune evasion, which is, it means they will be easy to not only infected person, but also to the one or someone who are already vaccinated, still these virus can also infect it. Of course, though they do not, this variant or also variant, do not appear to cause more severe illness in vaccinated individual. So again, as you mentioned, many individuals received their last vaccine close over maybe 2 years ago, and immunity both from vaccines and natural infection wanes over time, and especially again the new subvariant. And the other also why contributed to the this let's say increasing cases is about the lower adherence to preventive measure, the marked usage, ventilation awareness, physical distancing, etc. And also we also know that the travel and mobility now increase compared to pandemic situation, particularly around holidays and festival, and transmission opportunity have multiplied also during that time. And of course, for some country like Indonesia, we have limited surveillance and testing, as I mentioned. And this is also because reducing of funding and lower testing rate in the countries. It means outbreaks are often detected later. So it's late, delaying public health response, or, so it means it is not easy to get updated data for COVID-19 cases at the moment. And of course, last but not least, we also should really aware that the climate and seasonal effect in some ASEAN countries, for example, the monsoon, the weather season encourage indoor crowding and contributing also to increase of the COVID-19 transmission.
Okay, now we talk about the response from the Indonesian Health Minister Budi Gunadi Sadikin on Tuesday, June 3rd, at a meeting with President Prabowo Subianto, that he said the current COVID variants spreading are mild and not deadly. What do you think about this statement?
Yeah, this is correct statement. This is not deadly as before, but we have to also, I think, don't miss in strategic risk communication. I teach this subject. So we have to also balance the information. So it's mean that's a good news, but that this COVID-19 is not letally or fatal like before. But for certain people, especially the vulnerable ones, the elderly, the weak one, the weak immune system, that one, people with cancer, people with HIV, they are very prone and they are very vulnerable to this disease. So the total case fatality rates now reducing to become 0.4%. That means it's reduced significantly compared to the case fatality rate during pandemic. because at that time was like almost 2% for case fatality rate. But the 0.4 percentage of this case fatality rate happened among the most vulnerable one, which is elderly, more than 65 years old. That's the proportion is around 88% of people above 65 years old die due to COVID-19 this year. So it means we have to also remind this, the public, the vulnerable one, of course, and then also the government, especially the health facility, that we have to protect this most vulnerable one, because COVID-19 still can get fatal effect to them. And that's why we have to following this statement with the advice how to mitigate this COVID-19.
Okay. Steps to prevent this virus, especially to the vulnerable ones. So what can people do to protect themselves, particularly the vulnerable ones?
Okay, so for public, first get vaccinated if you still not get COVID-19 vaccine. Then for the vulnerable ones, only for the vulnerable one, the most vulnerable one, which is, of course, if you are, let's take, you are above 65 years old, it is strongly recommended to get booster for the COVID-19 vaccine. But the problem in Indonesia, as far as I know, we don't have the update vaccine for COVID-19. So the best prevention or mitigation that we can do is wear masks in crowded indoor spaces or on public transportation, especially during these spikes, and stay home when you are sick. And if you have symptoms, test and inform close contact to take a rest. And also, we have to remember the COVID-19 is spread through air. So ventilation matters. So improve airflow at home, workplaces, schools, and public venues. Use antivirals early if you are high risk and test positive. Of course, after you consult with the doctors. And don't hesitate to consult healthcare providers immediately. Of course, I want also to give advice to government and health authorities, because this is also very important. And I also contribute with the letter distribution of reminding about the awareness, alertness of these COVID-19 cases from the Minister of Health. Then following that, I want to give advice first to the government. They have to strengthen surveillance, including, of course, sentinel sites and also hospital-based tracking. And also second, resume public health communication campaigns to using risk communication strategies. It's mean not only saying, not only delivering the communication, but also make sure the people understand the point of this message. Because then we have to rebuild awareness about 5M. You don't know, 5M is like wearing masks, hand washing, and etc. Without, of course, without causing panic. That's the benefit or the useful of risk communication strategy. And of course, the third, ensure booster supply, especially updated vaccines for the most recent variant. I never and do not recommend or advise the government to import many vaccines, but at least for the most vulnerable one, we have the most updated vaccine with the most recent variant. That's also important. And the fourth, protect healthcare capacity by preparing hospital or puskesmas in Indonesia, we call it, community health center, for seasonal surges and ensuring staff readiness. Because even though we know this COVID-19 now do not impact or give, let's say, severity or also fatality, but the preparation, the preparedness of the hospital and also health services is still needed to anticipate the rising of cases. And the last one, to the government and health authority, my advice is they have to support research and innovation, because particularly around long COVID, because I want to send a very important message. COVID-19 now is, for many people, and including for the scientists like me, the concern is not about the acute phase of this disease, but the most concern, the most important and also worriness is the long COVID, which is the chronic phase of this disease. So we have to also, like many developed countries doing, they doing research and particularly in on long COVID, and we have to see also the situation of this long COVID in Indonesia by doing research, and of course the variant tracking research. It's also very important to make sure that we have enough early warning system and also radar to detect the variant within the country.
So the new vaccines are needed only for the vulnerable ones?
Yes.
Oh,
yes.
okay. But the vaccines that we have now is not the updated one?
Not yet. Not yet.
Okay. And about the letter issued by the Indonesian Health Ministry on the COVID alerts, we can consider it a precaution or something more?
Yep. That's very important letter, because it will rebuild and build awareness, not only for the health institution from top to lower level, but also for public or community, because they should be reminded that COVID-19 is still around and can be fatal and serious to the most vulnerable one.
Okay. So how can people live with COVID? I mean, responded wisely and properly towards the disease?
We have to realize that when the disease become endemic, like not only COVID, influenza, TB, dengue fever, malaria, or even HIV. HIV now become endemic, not only epidemic. Then, or in Indonesia, the most popular one is not popular, but notorious is typhoid. So it's mean we will see COVID-19, or that's all of disease I mentioned before, every day, every week, every month. And there will be, in certain situation, the increasing of this COVID-19. We will see seasonal waves, likely 1 or 2 per year. That's the expectation of endemic cases, endemic disease. And also high-risk population will remain vulnerable and must be prioritized for booster and antivirals. And also the new variant may continue to emerge, requiring ongoing genomic surveillance and also vaccine update again. But the good news, with proper management, including vaccination and early treatment, most people will experience mild symptoms. But that's why the Minister of Health letter issue, it's very important, and also I think in good time to again remind the health institution, and because the health system must remain alert all day, all month, all years, not only to COVID-19 but also to others communicable disease.
All right, Dr. Dicky Budiman, PhD, thank you so much for
My
sharing
pleasure.
with us so much insight about this sub-variants of COVID-19. And the World Health Organization itself recommends that countries remain vigilant, adapt to evolving epidemiological trends. Hopefully, with good management strategies, we can face this and hopefully stop the virus to spread. Thank you so much, Dr. Dicky.
My pleasure. Thank you.
Well, listeners, that's today's VOI Talk with Dr. Dicky Budiman, PhD, as the Global Health Security Expert of Griffith University and Yarsi. Take care and stay safe. Stay tuned for more insightful talks only on Voice of Indonesia, from Indonesia to the world.
Voice of Indonesia, the overseas service of Radio Republic Indonesia, broadcast in 9 language services: English, French, German, Dutch, Spanish, Arabic, Mandarin, Japanese, and Indonesian. Voice of Indonesia is broadcast via shortwave 3325 kHz and 4755 kHz, and via streaming on voinews.id and RRI Digital on mobile application. We present various programs for you: Diplomatic Forum, The Session, Indonesian Wonder, Miscellany, Let's Speak Bahasa Indonesia, Indonesian pop and regional songs, international musical entertainment,